Hello everyone and welcome. My name is Michael Phillip and I'll be your physical therapist for the next several minutes while I discuss early strengthening exercises following a lower extremity amputation. And I have to start off with a disclaimer that each patient's surgery is unique, so your doctor and physical therapist's advice is likely going to supersede anything here. So in this video, I'll be going over a more general guideline of what to expect following the amputation. From early on, when you're still in the hospital, the main focus will be spending time on healing and recovery. So protection of the wound is important, but light exercises can also play an important role in this process. In the hospital, the physical therapist will come in and evaluate you likely within the first several days. And then he or she is likely to go over with you some light exercises with the main goal to improve range of motion, increase blood flow, reduce swelling, prevent contractures, and get some of those muscle fibers firing again. They will likely start with range of motion exercises, which will help not only improve joint movement, but it's also a light way to initiate strengthening. Now, this will include starting to move the joint nearest the amputation again. We have to make sure that the joint does not lock up and it's fully functional, as it will be crucial in order to walk again with a prosthetic limb in the future. Strengthening early on will be focusing more on higher up muscles in the hips, glutes, and core in those first several weeks. Some examples of these exercises are leg raises while you're laying on your back, side, or stomach. Then there are bridges and glute sets. These muscles will be extremely important early on, as you will need them more than ever to help you with the simple tasks such as rolling over in bed and moving from your bed to the wheelchair when appropriate. Isometric exercises are another way to start strengthening in the first month. Now, this is where you push against something, but you don't cause a joint really to move. This may look something like the therapist asking you to push your leg just below your knee into his or her hand. He or she will resist the force, so there's no movement. So this is an isometric contraction. You may also do a similar one called glute squeezes or glute sets. This is where you tighten your butt cheeks and hold for 3 to 5 seconds. And then, prior to discharge from the hospital, you'll also be taught bed mobility, transfers, and how to use your assistive device. The therapist will be able to really help speed up your learning curve on these, as you'll likely be needing to perform some of these functional activities as soon as you get home. Some of the exercises discussed early in this video will have already begun to help with these tasks, but the therapist will now put it all together, and you'll likely be required to do a lot of this on your own prior to discharge. Once you are home from the hospital, you'll likely be signing up for home health, outpatient, or inpatient physical therapy services. Now, the new therapist will likely be different from the therapist you saw in the hospital and at a different location, but you'll be going 2 to 3 times a week for 6 to 8 months or longer. And this therapist will likely take your strengthening up a notch and be the one that's guiding you through the rest of your recovery process. I will put out another video on advanced strengthening exercises for those that are in those mid to later stages of the recovery. So watch out for that. I hope you learned a little bit as always, and please contact us if you have further questions. Take care. See you soon.